Welcome to Damal Consult Career Academy. Are you preparing for your NHS Healthcare Assistant Band to interview? Look no further. In today's video, we'll guide you through the top HCA interview questions and provide sample answers to help you succeed. Whether it's understanding the role, showcasing your skills, or nailing behavioral questions, this video is packed with expert tips to help you ace your interview and land that NHS job. Let's get started. 1. Can you tell us a bit about yourself and your background? Thank you for the opportunity to introduce myself. My name is Malafi, and I have a strong passion for healthcare, particularly in providing compassionate care to those who need it most. I have experience working in a care home setting and hospital setting, where I developed key skills such as patient care, teamwork, and communication. I've always had a natural inclination to help others, and that led me to pursue a career as a healthcare assistant. I have a deep understanding of the importance of empathy, respect, and maintaining patient dignity in all interactions. I'm trained in basic first aid, infection control, and providing assistance with daily living activities. In my previous role at Gaffey Hospital, I supported patients with personal care needs, helped with mobility, and provided companionship. I also worked closely with other healthcare professionals to ensure that patient care was delivered effectively. I am excited about the opportunity to work for the NHS because of its strong values. And I'm eager to contribute to a team where I can help make a difference in the lives of patients. I am committed to providing the highest quality of care, learning continuously, and developing my skills in this role. 2. What interests you most about working in healthcare? What interests me most about working in healthcare is the opportunity to make a meaningful difference in people's lives. I'm passionate about providing compassionate care to those who need it most, whether it's offering physical support or emotional reassurance. The healthcare field allows me to contribute to the well-being of individuals, helping them feel comfortable and cared for during times of vulnerability. Additionally, the dynamic nature of healthcare keeps me motivated, as I constantly learn and grow in a challenging yet rewarding environment. I am excited to be part of a team that prioritizes patient care and works together to deliver the best outcomes. 3. What do you know about the NHS and its core values? The NHS National Health Service is a publicly funded healthcare system in the United Kingdom, established in 1948. It provides healthcare services that are free at the point of use for residents, funded primarily through taxation. The NHS is one of the largest employers in the world, with a wide range of healthcare services, including primary care, hospital care, mental health services, and more. The core values of the NHS: 1. Respect and dignity, treating patients, their families, and colleagues with respect, and ensuring their dignity is maintained at all times. 2. Commitment to quality of care, delivering the highest standards of care to patients and continually striving to improve. 3. Compassion, providing compassionate care to patients, showing kindness and empathy in every interaction. 4. Improving lives, making a positive difference to the lives of patients and working to improve health outcomes for all. 5. Working together for patients, collaborating across teams and with patients to ensure the best care. 6. Everyone counts, ensuring fairness and equality for everyone, regardless of background, and making sure no one is left behind. As an NHS healthcare assistant, I believe these values are fundamental in delivering the best patient care, and I am committed to upholding them in my role. They align with my own values of compassion, respect, and teamwork. Before we proceed further in this video, I want to share an exciting resource with you. My e-book, Top 50 NHS Band to Healthcare Assistant Interview Questions and Answers. If you're preparing for an NHS HCA band to interview, this ebook is your ultimate guide to success. Inside, you'll find behavioral questions to help you showcase your professional mindset, situational questions to prepare you for real-life challenges, general and introductory questions to create a strong first impression, technical and competency-based questions to demonstrate your skills and expertise, hypothetical and problem-solving questions, including case studies, to show your ability to think critically. And that's not all. The ebook includes free tips on how to pass the NHS Band 2 Healthcare Assistant interview and a detailed guide on using the STAR approach to craft outstanding answers. This is everything you need to confidently pass your interview and secure your dream role in the NHS. Click on the sealer or fourth wall link in the description box of this video to download your copy now. It's very, very affordable. To order yours, simply head to Sealer.co, the link is in the description, or click the fourth wall link in the description. For more details, you can chat with our online customer care representative via WhatsApp at 2,348,101,066,191 or send an email to damilconsult08@gmail.com. Don't miss this opportunity. Get your ebook today and take the first step toward acing your NHS HCA band to interview. Order now. Links are in the description box. Good luck with your interview preparation. 4. Why do you believe you are the right fit for this role? I believe I am the right fit for this role because of my strong passion for providing compassionate care and my commitment to supporting patients in their healthcare journey. I have the ability to build positive relationships with patients, ensuring they feel respected, safe, and cared for. I am a quick learner and adaptable, which I know is important in a fast-paced environment like the NHS. Additionally, I am skilled in working effectively as part of a team, collaborating with other healthcare professionals to deliver high-quality patient care. My attention to detail ensures that I can follow procedures accurately and provide the best care possible while maintaining patient dignity and confidentiality. I am also highly motivated to continue learning and improving my skills through training and hands-on experience. My dedication to helping others, combined with my ability to remain calm under pressure, makes me confident that I will excel in this role and contribute positively to the team and the patients. 5. What motivates you to provide high-quality care to patients? I am motivated to provide high-quality care to patients because I believe that everyone deserves to be treated with respect, compassion, and dignity, especially when they are vulnerable. Knowing that I can make a real difference in someone's life, whether it's offering comfort, assistance, or simply providing a listening ear, gives me a strong sense of purpose. I am driven by the opportunity to improve patient outcomes by providing safe, effective care and supporting patients in their journey to recovery or maintaining their well-being. Additionally, I take pride in working as part of a team to deliver the best possible care and learning from others to continuously improve my own practice. 6. Why do you want to work as a healthcare assistant for the NHS? I have always had a strong desire to help others, and working as a healthcare assistant for the NHS allows me to make a meaningful difference in people's lives every day. The NHS is renowned for its commitment to providing high-quality, compassionate care, and I want to be part of that mission. I believe in the values of respect, dignity, and empathy that are core to the NHS, and I want to contribute to delivering patient-centered care. Additionally, I am passionate about healthcare and supporting individuals during their most vulnerable moments. I appreciate the opportunity to work in a team environment where we collaborate to improve patients' well-being. I see this role as an opportunity to continue developing my skills, gain hands-on experience, and grow professionally while supporting patients and contributing to the excellent care the NHS is known for. 7. Can you describe your understanding of the role of a healthcare assistant? As a healthcare assistant HCA, primary responsibility is to support healthcare professionals, such as nurses and doctors, in delivering high-quality patient care. My role involves assisting patients with activities of daily living, such as feeding, bathing, dressing, and toileting, while ensuring their comfort, dignity, and respect. I would also be responsible for monitoring patients' conditions, such as checking vital signs, temperature, blood pressure, pulse, assisting with mobility, and ensuring a safe and clean environment. Additionally, I would be expected to maintain accurate patient records, support patients emotionally, and communicate effectively with both patients and the healthcare team. It's crucial to ensure that infection control protocols are followed and that patient confidentiality is always maintained. In a Band 2 position, I understand the importance of providing compassionate care and working as part of a team to improve patient outcomes while adhering to NHS guidelines and policies. 8. How would you ensure patient dignity and confidentiality while providing care? In my role as a healthcare assistant, ensuring patient dignity and confidentiality is of utmost importance. To maintain dignity, I would always approach patients with respect, speaking to them politely and listening to their concerns without judgment. I would ensure privacy during personal care, such as closing curtains or doors, when assisting with dressing, toileting, or other sensitive activities. I would also communicate with patients in a way that empowers them, asking for their preferences and respecting their choices, to make them feel comfortable and valued. When it comes to confidentiality, I would ensure that all patient information is handled securely. I would follow the NHS guidelines and policies regarding patient confidentiality, ensuring that any information shared with colleagues is on a need-to-know basis only. I would never discuss patient details outside of the professional setting, and I would securely store any physical or electronic records, ensuring they are only accessible to authorized personnel. By being mindful of patient privacy, both physically and with information, I can contribute to a safe, respectful, and trusting environment for all patients. 9. What would you do if a patient refused care or assistance? If a patient refused care or assistance, my first step would be to approach the situation calmly and respectfully. I would try to understand the reason behind their refusal by asking open-ended questions, such as, is there something specific you're concerned about? Or how can I help make this more comfortable for you? It's important to listen to their concerns and acknowledge their feelings. I would reassure the patient, providing them with clear information about the care they're being offered and why it's necessary for their well-being. It also gives them the time and space they need to make an informed decision. If they still refuse, I would document the refusal in accordance with NHS protocols and report it to the supervising nurse or doctor to ensure the patient's rights and safety are respected. Above all, I would ensure the patient feels empowered in their care decisions, while maintaining a professional and compassionate approach. 10. How do you handle stressful situations or emotional challenges in a healthcare setting? In a healthcare setting, stressful situations and emotional challenges are inevitable, but I believe it's important to remain calm and composed. I handle stress by focusing on the task at hand and prioritizing patient care. When emotions are high, I remind myself to take deep breaths, stay positive, and communicate effectively with both patients and colleagues. I also believe in teamwork and don't hesitate to ask for support from my colleagues or supervisors when needed. For example, if a patient's condition worsens or there's a challenging situation, I would collaborate with the healthcare team to ensure the patient receives the best care possible. Additionally, after a particularly stressful situation, I make time for self-care and reflection to prevent burnout. I understand the importance of maintaining emotional resilience and take steps to manage my well-being, such as talking to others for support, practicing mindfulness, or engaging in activities that help me relax. 11. Can you give an example of a time you worked as part of a team to deliver excellent care? Yes, I can. In my previous role, I worked as part of a team to provide care for a patient who had recently undergone surgery. The patient was recovering in a post-operative ward, and our team, which included nurses, doctors, and other healthcare assistants, worked together to ensure the patient's recovery was smooth and comfortable. I was responsible for assisting with the patient's mobility, helping them with daily hygiene, and ensuring their comfort throughout the day. I worked closely with the nursing staff to monitor the patient's vital signs and update their care plan. Additionally, I communicated regularly with the doctors about any changes in the patient's condition. One particular instance stands out. The patient was struggling with pain management and was feeling anxious about their recovery. I collaborated with the team to adjust the care plan, ensuring the patient's pain relief was more effective. We also made sure to spend time talking with the patient, offering reassurance and emotional support. Thanks to the collaboration and communication between all team members, we were able to improve the patient's comfort levels and support their speedy recovery. This experience reinforced how crucial teamwork is in providing the highest standard of care to patients. 12. How do you ensure proper infection prevention and control measures are followed? To ensure proper infection prevention and control measures are followed, I would adhere to NHS infection control policies, including hand hygiene, the use of personal protective equipment (PPE), and following standard precautions for infection prevention. Regular hand washing with soap and water or using hand sanitizer is essential, especially before and after patient contact or handling equipment. I would always ensure that I am wearing the correct PPE, such as gloves, masks, and aprons, based on the situation and patient's condition, and dispose of them correctly after use. I would also assist in maintaining a clean and sterile environment by ensuring that patient areas, equipment, and surfaces are regularly cleaned and disinfected. If appropriate, I would educate patients on proper hand hygiene and cough etiquette to minimize the risk of infection. Additionally, if I noticed any potential infection risks or breaches in protocol, I would immediately report them to the relevant team member to address the situation and prevent any outbreaks. By following these steps and collaborating with the healthcare team, I would contribute to maintaining a safe and infection-free environment for both patients and staff. 13. What would you do if you noticed a significant change in a patient's condition? If I noticed a significant change in a patient's condition, my first priority would be to ensure the patient's safety and well-being. I would carefully observe and document any changes in their symptoms or behavior, such as alterations in vital signs, physical appearance, or mental state. Then, I would immediately inform a senior healthcare professional, such as a nurse or doctor, to ensure that the patient receives the appropriate attention and care. I would follow any instructions given by the senior staff and assist in providing comfort or administering first aid if required. Once the situation has been addressed, I would ensure accurate documentation of my observations and the actions taken in the patient's care record, as proper documentation is crucial for ongoing care. Throughout this process, I would remain calm and compassionate to ensure the patient feels reassured and supported during a potentially distressing situation. 14. How do you prioritize tasks when caring for multiple patients? When caring for multiple patients, prioritization is key to ensuring the best care is provided. First, I assess the urgency of each patient's needs. For example, I would prioritize patients who require immediate medical attention, such as those in pain or experiencing distress, over tasks that can be addressed later. I also take into account the specific needs of each patient, such as whether they need assistance with personal care, mobility, or medication. I follow any care plans or protocols in place, and I make sure to communicate effectively with other healthcare team members to stay aligned and ensure nothing is overlooked. Time management is crucial, so I break down my tasks into a clear order of priority and regularly reassess as situations change. I also try to remain flexible and calm, especially in busy or emergency situations, ensuring that each patient receives the care they need in a timely and compassionate manner. 15. Why is patient communication important, and how do you ensure effective communication? Patient communication is crucial because it directly impacts the quality of care and the overall patient experience. Clear communication helps to build trust, alleviate anxiety, and ensure that patients feel heard and understood. It allows healthcare assistants to gather essential information about a patient's condition, ensuring that the care provided is appropriate and tailored to their needs. Effective communication also helps in educating patients about their care plans, promoting better understanding and adherence to medical instructions. To ensure effective communication, I focus on active listening, making sure to give patients the space to express their concerns and feelings fully. I use clear and simple language to avoid any confusion, especially for patients who may be anxious or unfamiliar with medical terms. I also pay attention to nonverbal cues, as they can provide valuable insights into how the patient is feeling or if there's an issue they haven't voiced. Additionally, I approach each interaction with empathy and compassion, showing the patient that I understand and care about their situation. I also encourage feedback, ensuring the patient feels comfortable asking questions and clarifying any doubts, which helps build a strong, supportive rapport throughout the care process. Do you have any questions? When asked, "Do you have any questions?" in an NHS Healthcare Assistant Band to interview, here are some questions you can ask to show your interest and gather more information about their role. 1. Can you describe the day-to-day responsibilities of a healthcare assistant in this role? 2. What are the main qualities you are looking for in a successful candidate for this role? 3. How does the NHS support the personal and professional development of healthcare assistants? 4. Can you tell me about the team I would be working with? 5. What are the main challenges a healthcare assistant faces in this role, and how do you support staff in overcoming them? That wraps up our guide to NHS Healthcare Assistant Band to interview questions and answers. We hope these tips help you feel confident and well prepared for your upcoming interview. If you found this video helpful, don't forget to give it a thumbs up, share it with others who might benefit, and subscribe to Damal Consult Career Academy for more expert advice on interviews, career tips, and professional development. Hit the notification bell so you don't miss any updates. Good luck with your interview, and well, see you in the next video.